How do you know if you're autistic? Getting an autism diagnosis with the NHS. People often begin wondering if they're autistic because they've noticed that some of the ways they think or behave seem to match the key symptoms of autism, or because someone close to them has noticed these differences and pointed them out. There are all sorts of things that might lead you to wonder if you're autistic, and it would be impossible to talk about them all. Some people might notice they're really interested in a specific topic, know much more about it than anyone else, and that not many people seem to be interested in finding out what they know. Others might struggle with sensory experiences, like finding loud noises or certain clothing materials unbearable. Or they might find it harder than others to figure out social interactions or communicate with people. If you're wondering if you're autistic, this film might help you understand how specialists might work with you if you decide to have an autism assessment. Autism is often talked about as a spectrum condition because it affects people in different ways, but it doesn't mean that everyone is autistic. There are specific criteria for diagnosing autism. We all communicate and find things interesting, but when thinking about whether someone is autistic, doctors think about the person as a whole and how these things affect their everyday life to decide if they meet diagnostic criteria that have been agreed by experts. You might find tests online. They can be interesting to do, and some of them can give you an indication of whether you might be autistic. But it can be difficult to know how reliable any specific test is, and even the best ones aren't accurate enough to give you a diagnosis. In terms of getting a diagnosis, the best place to start is usually with your GP. They can refer you to a team of specialists. What this team is called will depend on your age and where you live. It might be a team in child and adolescent mental health services, known as CAMS, or a paediatric service, or an adult autism service, for example. These services are made up of lots of different professionals. They can include consultant psychiatrists, paediatricians, speech and language therapists, occupational therapists, and specialist nurses, as well as other people. At some point near the start of the process, you'll probably be asked to fill out a screening questionnaire. This might happen when you see your GP or after you've been referred. A screening questionnaire has a small number of questions that ask you whether you agree or disagree with certain statements. After this questionnaire, almost everyone has to wait on a waiting list before they have their appointment, which is usually called an assessment. Despite the name, this doesn't mean you're being tested or that there are right or wrong answers. The people you'll see will think about whether you meet the criteria to get a diagnosis of autism, or whether it might be more helpful to understand you and your brain in another way. Before your assessment, you might be sent another, longer questionnaire with more questions. As before, there are no right or wrong answers. Then, an autism assessment usually involves two things. The first is talking to you and someone important to you, like a parent, carer, or partner, and asking questions to find out more about you and your life so far. You'll have the chance to talk about things you're good at and your strengths, as well as the things you might find difficult and how you get on at home, at school, or work, and with other people. The other thing that will usually happen is called the Autism Diagnostic Observational Schedule, or ADOS. It's a tool that's used around the world and has different sections for people of different ages, from toddlers right the way through to adults. It just involves having a chat and then playing or doing activities depending on your age. As you can imagine, that can take a bit of time, especially because the people you're talking to will be thinking about whether there might be anything else going on as well as or instead of autism. Autistic people are more likely than non-autistic people to have a mental health condition, like anxiety or OCD. And so an autism assessment gives the people you're speaking to the chance to think about whether you might need support with your mental health too. After your assessment, you'll get a written report, which will include information like whether you meet the criteria for a diagnosis of autism, your strengths, and areas where you might need help or support. You might be given this report in person, or you might get it in the post. Unfortunately, people often find there is limited support after they have a diagnosis. It can depend on what's available in your area and whether you have another diagnosis like an anxiety disorder or learning disability, and that can feel disappointing and frustrating. There are some great organisations like the National Autistic Society, as well as smaller local organisations which offer lots of support for autistic people and the people who support them. This support isn't treatment. Autism is not an illness. It's part of who you are, and being autistic isn't a bad thing. Support is about helping autistic people to navigate a world that isn't always designed for them. It can involve changing things like your environment and how other people interact with you, as well as making sure you have the skills and support you need to live the life you want to live. The support that autistic people need changes throughout their lives too. The support you might need at school will be different to college or university or when you're working. It should always be designed with you at the centre and to help you stay safe, healthy and happy as you do the things that you love. If you think you might be autistic, would like to explore getting a diagnosis, the best place to start is to make an appointment with your GP. For more information about autism and support for well-being, check out the Best For You website.